quantum adjustment, big change adjustment. Why are patients driving 100 miles for this adjustment? Surely they can find a chiropractic adjustment much closer, but the quantum adjustment brings into play multiple factors, and I want to explain those to you at the moment. So the first is left and right brain balance. Our brain needs to be balanced. If it's not, it creates significant problems for us. And 90% of the role of the brain is to inhibit the sympathetic nervous system and not let that fight or flight nervous system take over. When the fight or flight nervous system takes over, we have tight muscles, we have muscle fatigue, we have a loss of strength and resistance, we have postural distortions, we have pain and numbness, we have chronic digestive issues, incontinence, loss of memory, loss of concentration. We can get high blood pressure, irritability, impulsiveness, inflammation, and just plain be burned out. And the interesting part is we can have some of those symptoms more on one side than the other. We can have more tightness on one side of our body. You've probably noticed that. You can have more fatigue in the muscles on one side of the body. You can have more loss of strength or resistance on one side of the body. You can have postural distortions on one side of the body. And when the brain becomes unbalanced and the left and right don't fire equally, then we've got some issues. So if the right brain is under firing, we're going to tend more toward anxiety or ADHD, attentional issues. If the left brain is under firing, we're going to tend more toward depression. And we're going to have problems on the side of the body that the brain is under firing. And this is something that a regular chiropractic adjustment is not necessarily going to address. In fact, it's not. Because we have to specifically direct the information to one side of the brain versus the other. So there is a specific pattern that we adjust you in. We also use something called eye lights. And eye lights are glasses that flash for 2 seconds and turn off for 8. And there they go. They help strengthen the weaker side of the brain. So they will flash for 2 seconds. You can just barely see them here on the video, but they'll flash for 2 seconds and turn off for 8. This drives information to the correct side of the brain depending on how we have them set. I have them currently set to drive information to the left side of the brain. Then we adjust you in a specific pattern, stretching flexor muscles on one side and extensor muscles on the other side. And there's no popping or twisting to this. It's just stretching muscles in a specific pattern, one side versus the other, to drive information to the brain and allow the brain to become balanced. And as the brain becomes balanced, we get equal posture, we get equal muscle tone, we get equal muscle firing, we get equal amounts of fatigue, or the muscle stays strong just as long on one side as the other. But more importantly, we inhibit the sympathetic nervous system on that side so that we're not getting increased breakdown on that side. I've seen patients where I ask them about surgical history and they've had a surgery on a shoulder on the same side, they've had a surgery on a knee and a hip on the same side, on the very same side, no surgeries on the other side. Why is that? It's because their brain was unbalanced and causing these muscle distortion, muscle fatigue, and loss of strength and resistance on one side, and so the joint was more vulnerable to injury. So that's the first thing that we do with this quantum adjustment, is balance the left and right brain. Very, very powerful. It's from a technique called quantum shift technique. The next thing we look at is central integration. Central integration means when we lose it, it's the loss of the ability to control the core muscles on both sides of the body at the same time. And so we'll test a hamstring muscle, we'll find it strong on one side, we'll find the hamstring strong on the other side, and then when we test the hamstrings bilaterally, they're weaker. They don't have the same resistance, and that is a central integration issue. And with central integration, we're looking at the bladder. It often drops inferior. We're looking at anterior discs that move anteriorly, forwardly in the low back. We're looking at the stomach, which often migrates up, and that gives us indigestion and reflux and all those kinds of things. So we can have bladder issues, we can have stomach issues, digestive issues. The clavicles can get inferior, the head can get forward, and the jaw can go out of alignment. And those are the 5 major things that we look at with central integration to correct it. And that is super powerful in helping us be balanced and not injure our spine. Plus help us get rid of these issues with the bladder and indigestion and more. Now the next thing we do in our quantum adjustment, because we're combining techniques, and they both happen to begin with the name quantum, but the next technique is called quantum neurology. It's nervous system rehabilitation. So in nervous system rehabilitation, we're looking at several things. One, motor rehabilitation. That is specific nerve circuits to specific muscles. So for example, C6 in our neck goes to our biceps. If we test the biceps and it's weak, it doesn't fire properly, then we've got to reset C6. And we do that with red light therapy and with our arthrostim adjustment, which involves no popping or no twisting. And let's see if I've got a light here. I don't. So we use those tools to help restore that muscle connection, and I've got other videos where you see the arthrostim and the red light therapy. We also use sensory rehabilitation. Now sensory rehabilitation is dealing with pain, temperature, both hot and cold, vibration sense, light touch, deep touch, pressure, proprioception, the ability of the brain to recognize the movements that we make, and form recognition, the ability of the nervous system to recognize forms and shapes. Those are sensory rehabilitation tools. Sensory rehabilitation tools. Again, we use red light therapy while we activate the specific nerve actions. So if we were dealing with pain, we might take a pinwheel and run across the hand and check if the nervous system gets inhibited through a muscle test. And then we know we need to reboot that. And so while we're using the pinwheel on the hand, then we would use the adjustment, again, no twisting or popping, and the red light therapy to reset that nervous system and reset the sensory connections. The next thing we're going to deal with in quantum neurology is visceral rehabilitation. Visceral rehabilitation is getting the shared nerve supply into play for the different organs and tissues. In fact, one of the people that drives 100 miles for their adjustment has had great improvements in their blood pressure because we've been improving the nerve supply to the liver, to the kidneys, and to the heart. And as we improved that nerve supply, their blood pressure lowered and lowered, and they were able to get off different medications. And we've got a video related to that as well. So that's visceral rehabilitation. Visceral rehabilitation is important for all of the organs to restore these connections to the thyroid or the thymus, which is an immune gland, or the spleen, which is an immune gland, and very often involved in many of the autoimmune patients that we take care of. Next, we work with cranial nerves. Cranial nerves are the nerves that control your eyes, your ears, your facial movements, your facial sensation, your jaw, your shoulders and your neck muscles, and your tongue, and your vagus nerve, which controls your throat, your swallowing, your ability to say ah, and activate all those areas. And that's vagus nerve is super big for reducing inflammation and getting your body into a rest, digest, and repair mode. So that's the visceral rehabilitation and the cranial nerve rehabilitation, both motor and sensory. So if there was a problem with your eyes, we might have you watch my finger go in a figure 8. If your nervous system inhibits, then we're going to use the red light therapy and the adjustment to reset that and reset the ability of the eyes to track through the cranial nerves that control the eyes. The same for the tongue, or the same for the vagus nerve. We're going to reset all of that. The next thing that's involved with quantum neurology is performance. And by performance, I mean, yes, we can test a muscle that 100% of my effort here is to resist this and my muscle is strong. But what if my nervous system is doing another action at the same time, like trying to hold this arm up, and we test this at the same time and it breaks down? That's called the Gonzalez point of interruption, or GPOI, a GPOI weakness. And so that finds hidden weaknesses, and we're going to check those relative to the neck, to the shoulders, to the core muscles, to the hips, to the legs, to the feet, to the gait. Very, very powerful in improving performance, especially for athletes. The next thing we're going to look at is the ability of the range of motion to occur in all, for the brain to be connected to all parts of the range of motion. So if we're taking our biceps, for example, again, we're going to have the person resist. They're going to put pressure against my fingers here as they go out, and pressure against my fingers as they come back. And then same thing, pressure against my fingers as they go out, and pressure against my fingers as they come back. All the while we're testing another muscle at the same time. This helps reconnect the brain to the all parts of the movement, and during that time we're going to be using the red light therapy on them. So that's called a race, a racing resisted agonist, antagonist, concentric, eccentric. Big words, but it means that we're going to connect the brain to all parts of the range of motion in the muscle. And that is really, really powerful for athletes. So powerful, so powerful. The next thing we're going to look at is something called Neuro Expression. Neuro Expression is how different elements of our nervous system combine to react to something. So if we step on a nail, my foot's going to come up, my hand's going to come back likely, I'm going to make a face, and I might, make some bad sounds. All those things are going to happen. That's the neuro expression of stepping on a nail. Well, sometimes when we need to correct something, we have to put the patient into that neuro expression. We have to address the issues of their face, their cranial nerves, their hands, their movements of their leg, the sensation at the bottom of their feet, and reboot that all at once so that their nervous system can, again, recover from that injury and fire properly and work its best. That's called neuro expression. So you can see there is a lot involved in this quantum adjustment, and that's what we're going to deliver to you. And in fact, I only know a couple other docs in the entire country that are certified in quantum neurology and have taken the quantum shift technique that relates to brain balance and central integration that we talked about in the beginning. So we've got some really unique things for you. That's a very, very powerful adjustment and very comprehensive adjustment. And that's what we're going to be bringing you more during the decade of 2020s. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. Be sure and subscribe to us on YouTube, like us on Facebook, and find some of our groups on Facebook, like our Drugless Support for Autoimmunity group. Just go to Winters Wellness on Facebook, click groups, and ask to join those groups. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined. Looking forward to helping you in the future, and we do take care of people from out of state often. Several times a month we're taking care of somebody from out of state that travels in to see us, drives or flies to see us, and spends 2 to 4 days or more with us to rehabilitate their nervous system and help them recover from autoimmune conditions or other chronic problems. I'm Dr. Michael Winters, Winters Wellness Chiropractic Redefined.